Can a really bad UTI actually make you hallucinate? Could eating a tapeworm be a good alternative to Ozempic? And why do men really wake up with erections in the morning? Today, we're diving into some of the weirdest, most uncomfortable medical questions pulled straight from Discord and the depths of the internet. All right, let's dive right in. Can a really bad UTI actually make you hallucinate? Yes, a urinary tract infection. And as a doc, sometimes we characterize it as cystitis, which is like a bladder infection. Sometimes it can be pyelonephritis, where the urinary tract infection gets up into your kidneys. But what can happen is sometimes that infection can start to get into your bloodstream. Usually when that happens, people will start to become septic, and part of that sepsis product basically is confusion, agitation, altered mental status, or delirium. But most of the time we just call it AMS or altered mental status as a broader category. We see this commonly in the elderly population. If you got bitten by a venomous snake in the wilderness, should you really cut the wound and suck out the venom like the movies show?
Somebody, suck out the poison, please! Oh.
Absolutely not. Please don't do this. They've done studies on this. They used to have these like venom extractors. They used to have venom kits for the wilderness, but they've found that they do minimum. They might cause more issues relating to infection, bleeding, but they literally showed that like trying these attempts was less than 2% of getting the venom out. What you would do, get to the hospital ASAP or get out of the wilderness ASAP. Keep it below the level of your heart. Don't try to increase your heart rate and maneuvering it around your system so much faster by running, unless you truly have to get away from danger per se. Say I had an allergic reaction. Is there anything that could mimic epinephrine if you were to go into anaphylactic shock but didn't have an EpiPen? So yes, unfortunately, there are no mimics to epinephrine or the EpiPen. It is the first line treatment for an anaphylactic reaction. We know it. It's the airway compromise, swelling, systemic collapse of our system to which you're vasodilating, you're hypoperfusing your organs, you might be closing your airway. So there are other medications that we do use, such as Benadryl, Pepcid. The way those work are not the same as how epinephrine works. Are you allergic to anything? Let me know in the comments. Why do doctors sometimes have to put a finger in your butt during a physical exam?
100% Moon River.
So yes, the DRE, aka the digital rectal exam, is done and taught in medical schools and what doctors are typically looking for. So if you're a male, you have a prostate, and so we will be trying to feel the prostate and see if there's any bogginess, if there's any masses. We're doing that, say you have possible infection, possible concern for cancer, also checking for rectal tone if there's any spinal cord injury, so you're looking to see if there's still rectal tone there. That's what we're going to be doing it for. Unfortunately, it is an uncomfortable test, but it does give you a decent amount of information clinically. If I wanted to lose weight but didn't want to take things like Ozempic, could I just eat a tapeworm or something for quick weight loss? I mean, great idea, but it's a terrible and dangerous plan. Tapeworm infections can lead to abdominal pain, malnutrition, vitamin deficiencies, could also lead to seizures. So no, please don't do this. But historically in like the 1900s, they actually had the tapeworm diet, but it's pretty dangerous. You don't know if your antiparasitic meds actually going to help, and there's a lot of other consequences relating to it. So please don't do that. It's very dangerous. Is it true untreated STIs can cause infertility later on? Yeah, actually it can, specifically like chlamydia. And how, you might ask? Well, what ends up happening is that infection, say for a female body, ends up causing infection within the reproductive organ, aka the uterus and the fallopian tubes. It can cause pelvic inflammatory disease, it can cause a tubo-ovarian abscess, it can affect not only the uterus, but also the fallopian tubes, and then it can get scarring, which can lead to the egg and sperm not meeting or not transmitting appropriately into the uterus, so it doesn't implant appropriately. So there are issues. Is it possible to sweat different colors? Actually, yes. It's quite rare, and I've never seen it with my own two eyes, but it does happen, and it's actually something called chromhidrosis. It's when those apocrine glands specifically, produce the sweat, but it can produce yellow, green, even black colored sweat. If this has never happened to you, and then all of a sudden you do start sweating a different color, that's a little bit concern for me. So definitely get to the hospital or get to your doctor, have them evaluated. There might be something off or something concerning, something changing within your own body that it needs to be checked out. Is it true that people's brains don't fully develop until their mid-20s? Or be honest, is it even later for guys? But yes, actually, we have a lot of real neuroscience research behind this that actually shows that your prefrontal cortex continues to develop into your mid-20s. And what the heck does the prefrontal cortex do? It has to do with decision making, impulse control, long-term planning. So we know that when we're in our early 20s, we have some of those not lacking, but are still developing. It doesn't mean that people don't make the right decision, but it's just that they're continuing to develop at that time. Girls versus boys. And so they actually have shown studies that women typically develop the prefrontal cortex a little bit sooner. They're thinking like 1 to 2 years. Recently, I started smelling something weird, like burning or smoke, but my girlfriend says there's nothing there. Should I be worried? This experience is called Phantosmia, which is you're smelling an odor that might not physically be present there. The concern is what is actually causing it. It could be allergies, it can be infections, so those are usually pretty benign, but there are concerns of like foreign bodies that might be in the way or tumors in the brain. So it needs to be evaluated if all of a sudden you have this new change of smell that you notice is not your baseline and you're not sick, you don't feel ill, you feel fine, definitely need to get checked out. You probably need a CT scan of your head, probably followed up by an MRI. Why do I drool when I sleep, and should I be concerned? Drooling is actually extremely common. Lots of people do it. It's usually not something to be worried about. So why do people drool? It's usually just related to your mouth open and gravity. So it happens mostly when people are side sleeping or sleeping on their stomach, and they might be congested, they may have sleep apnea, or they're not efficient breathing out of their nose. So they open their mouth and then the drool just comes out. Some people also might produce a little bit more saliva than others. So that also is a reason why you might be drooling. Speaking of sleep, some of the biggest things that disrupt a good night's sleep would be stress or irregular bedtime. These are some of the reasons why I came up with Do Not Disturb by my company Life Happens. Check out lifehappens.com or find it at Amazon. Why do humans still have wisdom teeth if most people just get them removed? Do they actually do anything? That is a great question. The real reason, it's like a leftover remnant basically of our evolution. Early humans had much bigger jaws and had more space in their mouth for the extra set of molars, as well as the foods that were eaten back then were much more fibrous, more tough, and required more smashing, grinding type of mechanical destruction of the food before it went into our stomach. Research is showing that there is a potential oral microbiome component to it. There's more surface area of teeth for the microbiome to hang out on, which then maybe has to do with like breaking down the foods, the different bacteria or pathogens that are available to stay in the mouth. They're still researching it and checking it out. Can using psychedelics permanently change how your brain works? We're saying psilocybin or LSD. These compounds affect basically serotonin in the brain. And so when people use them, it's typically a temporary event that is happening, but they increase the ability of neuroplasticity during these times. The changing of the serotonin, be it temporary, the neuroplasticity and the neuro changes that occur while somebody is on this, maybe during therapy or a guided event, can have long-lasting effects. Good treatments relating to like anxiety, depression, and PTSD, they've been trying to research. Now, if you do these psychedelics without being guided or in a different state of mind that you should be in, it does increase the risk of anxiety and what they call like the bad trips, and can actually lead to worsening effects. Why do men wake up with morning wood even if they weren't thinking about anything sexual? That it actually, morning erections is actually called nocturnal penile tumescence. And so that's actually a normal biological event that's happening usually multiple times a night and happens during REM sleep. It has to do with increased blood flow down to your member and you get an erection. It's actually one of the ways we test people who are having erectile dysfunction to see if it's actually a anatomy standpoint or is it a mental standpoint. But despite common assumptions, the morning wood or nocturnal wood is actually a biological event not related to sexual arousal or desire. My friend is really into the woo-woo wellness stuff like crystals, sound baths, and energy healing. Is there any alternative health practice that actually has real science behind it? Many of the alternative wellness practices don't actually have a lot of research behind it. One example would be like crystals and energy healing. It's really hard to study these practices, so you don't really have evidence of it. You have anecdotal statements by people who go through it, but they actually do have research to show that meditation and mindfulness as well as yoga does have an effect on our body, and a lot of it having to do with decreasing in stress, pain management, as well as mental health. Sound therapy, bowls, they actually do have effects on our bodies. It can reduce anger, stress, anxiety. So there are some of those effects as well, and they're continuing to be researched. As always, this was awesome. I love answering these kind of questions. So keep bringing them on. It's really good to have these conversations. And as always, definitely check out this playlist right here, Binge Watch It All. And please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.